In the following presentation, I will be giving a brief overview of what is a seizure, the major categories of seizures, and treatment of seizure disorders. In a normal active brain, the electrical impulses that send messages to the spinal cord, nerves, and muscles function in an orderly and organized manner. A seizure can be considered a disruption in the brain's normal electrical activity. There are two types of seizures, epileptic and non-epileptic. Epileptic seizures have no apparent trigger and occur repeatedly. It is generally unknown what causes epileptic seizures, but through research, they have been attributed to various brain disorders, such as structural abnormalities, strokes, or tumors. They are considered symptomatic epilepsy. Non-epileptic seizures are triggered by a reversible disorder or another condition that affects the brain, such as an infection or reaction to a drug. There are many types of seizures. 70% of people who experience seizures only experience one type. The remaining 30% experience two or more. Partial seizures only affect one side of the brain and are divided between simple and complex. Simple partial seizures are active in a small area of the brain and are confined to that one area. Symptoms are related to that small consolidated area that is affected. People who experience simple partial seizures are awake during the process and sometimes progress to a complex partial seizure. A complex partial seizure specifically begins in the area of the temporal or frontal lobe and quickly spreads to nearby areas. During the seizure, consciousness is partially impaired but not completely lost, and the seizure usually begins with an aura that lasts 1 to 2 minutes, during which people lose touch with their surroundings. About 20% of people who suffer from seizures experience an abnormal feeling beforehand, called an aura. An aura can include abnormal smells or tastes, a feeling of butterflies in their stomach, a feeling of déjà vu or the opposite, or an intense feeling that a seizure is about to begin. Abnormal behavior includes staring, chewing, or smacking the lips involuntarily, moving their extremities in strange, purposeless ways, uttering meaningless sounds, not understanding what others are saying, and even resisting help. Seizure disorders can include 7 subtypes listed for you, but I will only cover 5. The first subtype I will cover is primarily generalized seizures, defined by abnormal discharges in a deep central part of the brain and spreading simultaneously to both sides of the brain. Patients do not experience an aura, but typically give an outcry and lose consciousness. During the seizure, patients can experience muscle spasms and jerking throughout the body. They may even fall down, clench their teeth, bite their tongue, and/or lose control of their bladder and/or bowels. The second type of generalized seizure is a stereotypical image people usually have in their mind, a secondarily generalized tonic-clonic seizure, also referred to as a grand mal. It begins in a small area of the brain, resulting in a simple or complex partial seizure that quickly spreads to both sides of the brain, causing the entire brain to malfunction. Symptoms are similar to primarily generalized seizures. The next seizure subtype are absence seizures that can be either typical or atypical. Typical absence seizures usually develop in childhood from the ages of 5 and 15 and do not continue into adulthood. These seizures do not cause the stereotypical convulsions, but they have episodes of staring with fluttering eyes, and sometimes their facial muscles twitch. Usually, these type of seizures happen when people are sitting quietly and can happen a number of times a day if it's left untreated. Atypical absence seizures are less common and last longer than typical absence seizures. Patients show the stereotypical jerking movements, although not as severe as a grand mal, and people are more aware of their surroundings. Atypical absence seizures are usually a result of brain abnormalities or developmental delays and commonly continue into adulthood. I will cover the last two seizure subtypes together, atonic and tonic seizures. The only characteristics they have in common are that they both occur in childhood and they can cause them to fall to the ground during the episode. Atonic seizures are characterized by a brief but complete loss of muscle tone and consciousness, whereas tonic seizures increase muscle tone abruptly or gradually, causing the muscles to stiffen, and people do not normally lose consciousness. Tonic seizures occur commonly during sleep and typically last 10 to 15 seconds. If the child is awake and standing, they can fall to the ground. So, how does someone treat epilepsy? Well, the most common treatment for seizure disorders, because the abnormalities lie in the brain, are anti-epileptic drugs. I will refer to them as AED treatment. AED treatment works by modulating the excitability of neurons, either by counteracting problems with ionic balance or promoting inhibitory processes. Unfortunately, we cannot talk about medication without their subsequent side effects. The use of AED treatment is strongly related to non-adherence, which is the inability for the patient to respond to the medication. Non-adherence is also associated with continued seizures after discontinued use, drug toxicity, and can impact their quality of life. Other side effects associated with AED treatment are suicidal ideation and emotional and behavioral changes. Another course of treatment which is really interesting is the neurocybernetic prosthesis system, which is an implant that stimulates the vagus nerve. The burst disrupts seizure patterns from a generator surgically implanted under the skin of the chest, amounting to what some would call a pacemaker for the brain. The patient also has the freedom to induce stimulation when they feel a seizure may be coming on. It is believed that the vagus nerve has indirect connection to the areas of the brain often involved in causing seizures. The most severe form of treatment for chronic seizures is surgery. There are two very common types: locating the specific brain region that is affected and removing that brain region, or cutting the nerve fibers of the corpus callosum that connect the two brain regions when the seizures occur in multiple regions of the brain. Although most have caution to interfere with anti-epileptic drugs, there are complementary and alternative therapies, including diet changes, herbs, supplements, and acupuncture. It has been researched that a ketogenic diet that is high in fat and low in protein has shown greater improvement in children rather than adults. Taurine is an amino acid that may be involved in brain electrical activity that is associated to be low in people who experience seizures. The herbs listed either reduce the frequency of seizures or cause an inhibitory effect, acting as a sedative to slow down the nervous system. Holistic treatment should only be used as supportive medications and not the sole form of treatment. The most recent research has supported the method of using a multi-level approach to treating patients with seizure disorders. As discussed, non-adherence is a very potential threat, and researchers have supported the practice of assessing patients not only neurologically in relation to their condition, but also their emotional, cognitive, and behavioral needs before and during treatment. Patients have had more success using this model than just medication alone. Because seizure disorders affect the brain, they are very complex and should be treated in such a manner. Taking on a multi-directional, multi-method, and multi-level approach, assessing all-encompassing aspects of patients has been associated to promote a better quality of life.